Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to talk about glucose 6-phosphate dehydrogenase test. In short form we can say G6PD test. Okay. My name is Muhammad Kamal Khan and you guys watching Kami Microbiologist channel. Let's start the video. Now in this video, what are the main content that we are going to see? First of all, we are going to see that what is actually glucose 6-phosphate dehydrogenase enzyme and what are the glucose 6-phosphate dehydrogenase enzyme test is. Then we are going to see the purpose of this test, the method for the test means glucose 6-phosphate dehydrogenase enzyme. Then we are going to see requirements, that we are going to see the different methods. So different methods have different requirements. Then the procedures. So when we remember, when we are going to see the different methods, so each methods have different procedures. Then we are going to see the result and the normal range of the glucose 6-phosphate dehydrogenase enzyme. And finally we are going to see the main causes of low and high glucose phosphate dehydrogenase enzyme. Now let's see that what is actually glucose phosphate or G6PD test. So as the name indicates, so it is actually the test in which we mostly measure the level of the enzyme which we call it G6PD, glucose 6-phosphate dehydrogenase enzyme. So in this test we mostly check the level of G6PD. Now what is G6PD? It is actually the enzyme that is present in every cell, but mostly it is present into the RBC, and it is really important for the RBC. Now why? Because in the RBC it protect the RBC from the toxic substances, and these toxic substances is mostly producing from the cells, and it will be producing at that stage when the cell are performing the metabolism process. So due to this, toxic substance will be produced. But remember, if there is the glucose 6-phosphate enzyme within the RBC, so what happen? It will be protected from the toxic substances. Then it also prevent the RBC from the hemolysis as well as oxidative stress. Oxidative stress means the imbalance between the oxygen as well as the free radical compounds, and if there is imbalance, it will cause the rupture of the RBC. If there is oxidative stress, so what and let's suppose if there is a glucose 6-phosphate enzyme as well, so what happen? There will be the RBC will be protected from the lysis. Then we have the purposes. So remember guys, one thing that I must tell you and I forget to write here, remember glucose 6-phosphate deficiency is mostly occur when there is mutation in the X chromosome. Okay, because we better note that in male we have X and Y chromosome, while in female there is a 2X chromosome. So remember guys, if there is a mutation or some changes in the X chromosome, so then that patient will have glucose 6-phosphate dehydrogenase deficiency. So we can say it is actually the genetic disease as well. So the purpose of this test is just to check the deficiency of just to check the hemolytic anemia. So we better know that if there is deficiency of glucose 6-phosphate dehydrogenase enzyme, so obviously there will be hemolytic anemia. Why? Because the oxidative stress will be activated and toxic substance will be activated. Due to this way, the RBC will be not protected due to the deficiency of G6PD, and it will cause the rupture of the RBC, and due to this way the RBC level will be down, and this condition is called a hemolytic anemia. Then it is also important to check the unknown causes of the jaundice in children. Mostly the jaundice is actually the liver problem in children. Okay, that will make the children pale yellow color. Mostly the children have if they have jaundice. Now let's see the main causes of high glucose 6-phosphate dehydrogenase in the blood. So what are the main causes of the high glucose 6-phosphate dehydrogenase? So what are the main causes of G6PD in the blood? So it will be occur if there is high loss of the blood or chronic blood loss, means if there is the blood come out from the body due to some injury, so due to this way there will be a high level of glucose 6-phosphate dehydrogenase enzyme. Due to viral hepatitis, it means that liver problem, we can say. Hyperthyroidism means high production of the hormone from the thyroid gland. Hepatic coma, again this is the liver failure as well, we can say. And pernicious anemia and myocardial anemia. Pernicious anemia is actually the type of anemia in which let's suppose if the intestine failed to absorb vitamin B12, which is important for the RBC production. So what will happen? There will be anemia. This condition is called pernicious anemia. And myocardial anemia means that if there is a heart pumping is not properly, a heart is not properly working, and if there is heart problem, and due to this way the anemia will occur. So this is called myocardial anemia. Then we have myocardial infarction. So myocardial infarction is again the heart attack or heart problem related diseases. And we have idiopathic thrombocytopenic purpura. It is actually the condition in which the there is abnormal in the level there is abnormal decrease of thrombocytes. Thrombocyte means platelet, those cells that are mostly important in the clotting or in the clotting. So remember guys, if there is low level of the thrombocytes, so what will happen? Bleeding will occur inside, and sometimes bleeding will occur from the gum portion as well. So due to this way, what happened? Glucose 6-phosphate dehydrogenase will be high. Then we have the main causes due to which the glucose 6-phosphate dehydrogenase enzyme will be low, and these are the glucose 6-phosphate dehydrogenase enzyme deficiency. Obviously, if this enzyme is deficient, so there will be low level in the blood. And hemolytic anemia. So if there is hemolytic anemia, means again the same, if the RBC are ruptured and RBC level are low, we call it hemolytic anemia. And infection is also one of the most important causes of the low G6PD in the blood. So what we actually concluded from these two headings, we actually concluded that the glucose 6-phosphate dehydrogenase enzyme will be normal in our body. It will be not too much high and not too much low. Their level will be normal, and the normal range of this is 7.0 to 20.5. Okay, this is actually 20.5. Then we have the methods. So we have mostly three types of the methods to find out the glucose 6-phosphate dehydrogenase enzyme in the blood. The first method is the qualitative method, the second is the screening enzymatic method, and the third is the rapid method in which we mostly use the cassette or the strip. Okay, so inshallah ta'ala, in the next video lecture we will talk about the qualitative method. So this is actually the introductory portion of the glucose 6-phosphate dehydrogenase. I hope you guys understand, and if you have question, you can write it into comment. Inshallah, in the next video we will talk to the qualitative method. So please stay tuned and keep watching. Thank you.